Hello everyone. I welcome you all to the new episode of Meet the Knee Expert. We have with us Dr. Parag Sancheti. Thank you so much for joining us today, sir. Like always, we're going to have some interesting conversation with Dr. Parag on the varied issues related to healthcare. So today I wanted to pick your brain on a very interesting topic, because when we asked all our viewers and people visiting the hospital about what is one question that you would like to ask Dr. Parag, a lot of teenagers came back to us saying, is there a way to increase our height? So people who were facing that dilemma about, am I tall enough or not? And this seemed to be a very recurrent question. So have you ever been asked this question?
Ask me about it, Dr. Saurabh. I get asked this question all the time. And since I'm an orthopedic surgeon dealing with bones, everybody feels that the height can be increased by an orthopedic surgeon. Then for every OPD, I have at least 2 or 3 patients, in the age group between 12 to 20, 22, or sometimes even more, asking me this question: can my height be increased? Always, all the time.
Right. So before I ask you that, what is your answer to them? I would like you to explain our viewers, what is the science behind growth? What is the science behind increasing height? How does it work?
Yeah. So first of all, let me tell you the science first, and then we will talk about whether it can be increased, it cannot be increased. Let's just hold on to that question for a minute. So the science behind the growth of an individual, especially the height-wise, is related definitely to something called as a growth plate, which occurs in the long bones, especially the humerus, radius ulna, the femur, and the tibia. So there is something called a growth plate. It is a part of the bone which remains open and through which the height can increase. And this growth plate of an individual remains open generally up to the age of 15, 16. And sometimes in some individuals, even later it closes. It can be up to 17, 18. So to answer your question, the height of a person can increase only till the growth plate is open, and through that it can increase. But once it closes, which is on an average 16 to 18 years of age, after that technically there can be no growth, except sometimes at the age of 19, 20 there is a second growth spurt. At times there can be some increase in height there, but the majority of the height, 90% of the height, is up to the age of 16, 17 years, till when the growth plate in the long bones is open.